Dose calculations. The lack of basic math skill can be major problems for nurses while administering drug to patients. Calculation stands a significant source of drug error. So developing calculation skill relies understanding decimal to make sure conversion easier, and when using long division, it is essential to get it right way wrong. The objective of this session are as follows. To learn fundamental of converting matrix measurement, that is, matrix unit another, to know the drug dosage calculation for both oral and IV dosage forms, to know the procedure for initiation of insulin preparation for people with diabetes, to gain and understand the formula used to calculate correct medication for administration, to do exercises and know the examples of the same. At the end of the session, the viewers should be able to execute metric conversion, estimate both oral and IV dose calculation and required, recall the formulas for calculation of various doses of drugs and insulin preparation. Demonstration of matrix conversion from one unit to other unit is mentioned as in the slide and specifically need to be followed in those calculations. The dosage of the drug is determination of the amount, route, frequency and number of doses of medication for a patient. Dosage calculation includes formulation, name and amount of the drug. Dosage calculation includes calculating the number of dosages, dispensing quantities and ingredient quantities in a correct way. This calculation is performed in nurses' station on a daily basis. The nurses must have full working knowledge of how to perform this calculation. The principle involved in calculation of oral doses include following points. The strength of each tablet or capsule, that is, the amount of drug checked properly. The dose units should be certain, milligrams or micrograms being most commonly prescribed. The dose and units of medication prescribed should be cross-checked with the dosage and unit mentioned in the drug label. The prescribed drug unit and the unit of the label. If it is found having different strength, specific units conversion is required to be implemented. Both the units in the prescription as well as label of its conformed to have same strength. Division of dose by strength of the tablet or capsule is preferred. This formula is used to calculate the total number of tablet, that is, ratio of dose to be given divided by stock strength. A typical example is shown as in the slide. Similarly, the formula for calculation of dose in case of mixtures and solutions as follows. The ratio between doses to be given multiplied by stock volume wholly divided by stock strength. Principle involved in the calculation of IV dosages are as such. For parenteral solution, the amount of drug required to be checked in each ml as well as the total volume of drug in container. Abbreviation of dose units used has to be checked in priority, mostly for milligrams or micrograms. Dose of the such as insulin and heparin have to maintain in international units, assure that the dose in the prescription and the medicine label are same. Here we have the example of calculating IV dosage form. The dose given for morphine is 4 mg and the stock solution contain 10 mg per ml. The volume of morphine to draw up is 0.4 ml. The principle involved for the administering insulin injections are: insulin order is international units. Insulin syringe are made for administering insulin to the patient. Calibration has been done in insulin syringes with units, therefore no calculation is required. The marking in the insulin syringes are helpful to get desired units. All the insulin syringes are used in case of insulin administration. The principle involved for making two types of insulin preparations into one preparation are follows. Avoid contamination of one vial with the content of the other vial when mixing two types of insulin, such as regular and NPH. Always draw up regular insulin first. Always use caution when withdrawing NPH. Once you withdraw, you cannot inject medication to the vial. Procedure involved: gently rotate NPH insulin to mix well. Wipe the top of the vial with alcohol pad. Draw some units of air into the syringe and inject air into the NPH vial. Withdraw needle. Draw some unit of the air into the syringe and inject air into the regular vial. Invert the vial and withdraw some of regular insulin. Withdraw the needle. Insert the same needle containing regular insulin into the NPH vial and carefully withdraw some units of NPH insulin. Administered the insulin. Wash hand and properly dispose of the syringe. These are the list of insulin preparation involving their type, onset, peak as well as duration of action, along with their role in blood sugar management. Principle to be followed for calculating drip rate for gravity flow infusions. Rate of flow is measured by counting drops per minute, milliliters per hour, liters per hour, and insulin rate depends on gravity. It is important to check the number of drops per ml which is printed on the outer packing. This may vary between manufacturer and drug solution. The formula mentioned here is for calculating IV rates by drops per minute, which include the ratio between volumes in milliliter multiplied by number of drops per milliliter divided by duration of infusion in minutes. That gives number of drops per minute. A drug solution administration set will usually deliver 15 drops per milliliter of clear infusion fluid, such as 0.9% sodium chloride injection. 20 drops is set for administration of blood. Similarly, 60 drops is set for burette administration of drug solution. Here, a typical example on calculating drips rate for gravity flow infusions is mentioned. The first formula is mentioned for the calculation of milliliter per hour through drips rate, which is calculated through ratio between total volumes to be given in milliliter divided by time in hour. Similarly, the second formula is for the calculation of milligram per hour, obtained through the ratio between total volumes to be given in milligram divided by time in hour. Here, a typical example on calculating drips rate for gravity flow infusions is mentioned. When the doctor orders the medicine in the measurement system other than the metric system, you must be extra cautious that you don't make any conversion, erroring a dosage. For example, you must become skilled at converting from metrics to household units. Double-checking is standard practice intended to be improved patient safety, which required two health-qualified health professionals, usually nurses, independently checking prescribed medication before administration to the patient. Specific formula created on the basis of dosage form and route of administration should be implemented. The dose calculation should be reevaluated and the correctness of evaluation should be reassured before administering the drug. We acknowledge Rajiv Gandhi University of Health Sciences for their continuous support. Thank you.